What is Blair Upper Cervical Chiropractic? If you've searched what is Blair Chiropractic, you've probably noticed something. There isn't much information out there. And what you do find is often full of technical language that doesn't really answer the questions. So, in the next few minutes, I want to explain what Blair Upper Cervical Chiropractic actually is, who it's designed for, why it's different from traditional chiropractic, and why so many people tell me, I just wish I'd found this years ago. Let's start with the biggest misconception. Most people think Blair is simply a gentler way of adjusting the neck. It isn't. Gentle is the result, precision is the philosophy, and that difference changes everything. Every neck is different. Think about this for a second. If I took fingerprints of everyone watching this video, every single one would be unique. Nobody finds that surprising, that ain't news. Here's what most people don't realize. The top of your neck is just as unique. The joints are shaped differently, the angles are different, the way those bones fit together is different from one person to the next. So, here's the obvious question. If every upper neck is unique, why would exactly the same adjustment work for everybody? It wouldn't. That's where Blair begins. Not with an adjustment, with a question. How is your neck built? Because once you understand that, you stop trying to fit everyone into the same treatment. Question 2. Why does the upper neck matter so much? Now, you might be wondering, okay, but why focus on two small bones in the neck? Fair question. Think of your nervous system as the internet for your body. Your brain is constantly sending information. Move this muscle, balance here, turn your head, slow your heart, speed it up. That communication travels through the upper neck before reaching the rest of the body. Now, imagine the internet connection in your house. If there's a problem right where it enters the building, you don't necessarily lose everything, but you can start seeing strange issues. Slow speeds, drop connections, things that don't just work the way they should. The upper neck is similar. It's a small area with a disproportionately important job. That's why people don't come to Blair practices with just one type of complaint. Some people come in because of migraines, others because of vertigo, some have neck pain, others low back pain, sciatica, disc injuries, TMJ, post-concussion syndrome, trigeminal neuralgia, occipital neuralgia. Some are athletes looking to reduce injury risk or perform at a higher level. Some have simply reached the point where they've been told, next step is shots, next step is surgery. And they want to know they've explored every reasonable option first. Now, here's something that's really important. Blair isn't designed to treat all of those conditions individually. That would be an oversimplification. Instead, Blair focuses on improving the mechanics and function of the upper cervical spine because of the influence that region has on the nervous system. The goal isn't chasing symptoms, it's improving function. And when function improves, people often discover they can get back to doing things they actually care about. Walking around town lake without constantly thinking about their back. Getting through a work day without headaches. Sleeping through the night, training for a race, playing with the kids. Those are the outcomes that matter. Question 3. Why do Blair chiropractors spend so much time taking x-rays? This is one of the biggest differences you'll notice. Many people walk in, expect to get adjusted and leave. Blair doesn't work exactly like that because before we decide how to adjust someone, we first want to understand their anatomy. Those x-rays are not taken to find something scary, they're taken so we can answer one question. What is the safest, most precise way to adjust this person's neck? It's a little like having a tailor make a custom suit. You don't walk in and grab whatever happens to be hanging on the rack. Measurements come first. Because precision comes first, that's exactly what Blair is trying to accomplish. Question 4. Why don't Blair chiropractors twist or crack the neck? Probably the question we get more than any other. People lie down expecting the twisting, the cracking, the stretching, and that loud cracking noise. Then the adjustment happens and they say, wait, was that it? Are you done? Reason is simple. Let me use an analogy. Imagine a train has come slightly off the tracks. Most people picture brute force, push it, twist it, force it back on. But that's not how it's actually done. Rail workers use carefully positioned equipment. They lift the train just enough, guide it in exactly the right direction, small movement, huge result. This is Blair. We're not trying to move your neck a long way, we're trying to move it in exactly the direction your anatomy requires. Because when the direction is correct, you usually don't need very much force. That's why Blair is known for being so gentle. Not because gentle is the goal, it's the side effect of the precision. Question 5. Who is Blair really for? I don't actually think Blair is defined by a diagnosis. I think it's defined by the kind of person who chooses it. It's for people who appreciate precision, people who ask questions, people who want to understand why something is being done instead of simply having it done. Some patients have never seen a chiropractor before. Some people have had a bad experience with the chiropractor before. Others have tried traditional chiropractic and they're just looking for something different. People have tried physical therapy, massage, medication, shots, and they've simply reached the point where they're wondering, is there another option that I haven't explored? Athletes often love Blair because when you're competing at a high level, small changes matter. You don't have to be an athlete, but you just want to want to function at your best. Question 6. Why don't more chiropractors practice Blair? Another common question. This one's actually pretty straightforward. Blair is a highly specialized technique. It requires additional postgraduate education, detailed imaging, detailed analysis, and a philosophy that's built around spending more time understanding the individual patient. Quite frankly, it's more work, but also represents a relatively small part of the chiropractic profession. It doesn't mean every other chiropractor is doing it wrong. Far from it. It just means that Blair takes a different path, one that prioritizes precision over force, individualization over standardization, and specificity, try saying that 3 times fast, over repetition. Question 7, where are we? Is Blair for everyone? No. I actually think that's reassuring. No healthcare approach is right for everybody. If anyone tells you otherwise, be cautious. Anyone that speaks in absolutes, question them. Our job isn't to convince everyone that Blair is the answer. Our job is to help people understand what it is, how it works, and whether it makes sense for them. Sometimes the answer is yes, sometimes it isn't, and that's okay. Healthcare should always be about finding the right fit, not forcing one. So, what is Blair Upper Cervical Chiropractic? It's a specialized chiropractic technique built around one simple idea. Every neck is different. If every neck is different, then every adjustment should respect those differences. That's why Blair emphasizes detailed analysis, precise x-rays, specific corrections. And there is no twisting or popping, none of the scary cracky stuff, no ring dingers, because sometimes the smallest, most accurate change creates the biggest difference. What I've noticed over the years, the people who are most skeptical about Blair are almost always the people who've never experienced it. And that's okay. I treat a lot of chiropractors, and when we finish, they're like, was that it? I get it. Healthy skepticism is a good thing, but don't let unfamiliarity stop you from exploring an option that might genuinely help. If you've been dealing with headaches, neck pain, vertigo, disc problems, you've simply been told that your only remaining options are injections or surgery, ask questions, learn about it, see if it's right for you, because the worst case scenario is simple. You decide Blair Chiropractic isn't for you, but it might also be the one thing that helps you get back to the life that you've been missing. And in my opinion, that's worth finding out. My name is Dr. Andrew Newell. I am a Blair Upper Cervical Chiropractor in Austin, Texas. Thank you for listening.